Here's my list of 10 muscles. Orbicularis oculi, partial or complete closure of the eye. Orbicularis oculi, partial or complete closure of the eye. Orbicularis oculi, partial or complete closure of the eye. Attachments are from the margin around the orbit to the skin around the eyelids. Sternocleidomastoid, neck flexion, both, lateral flexion, 1, and rotation to opposite side, 1. Again, neck flexion, both, lateral flexion, 1, lateral rotation to opposite side, 1. Again, sternocleidomastoid, neck flexion, lateral flexion, and rotation to opposite side. Attaches from the mastoid process to the sternum and clavicle. External abdominal oblique, lateral flexion to same side, rotation to opposite side. External abdominal oblique, lateral flexion, same side, rotation, opposite side. External abdominal oblique, lateral flexion, same side, rotation, opposite side. And the attachments are from ribs 5 to 12 to the linea alba and iliac crest. Internal abdominal oblique, lateral flexion, same side, rotation, same side. Again, internal abdominal oblique, lateral flexion, same side, rotation, same side. Lateral flexion, same side, rotation, same side for the internal abdominal oblique. Attaches from the thoracolumbar fascia, ribs 8 through 12, the inguinal ligament and iliac crest, the linea alba and pubic bone. Trapezius, elevation, retraction, depression of the scapula, elevation, retraction, depression of the scapula. Upper fibers elevate, middle fibers retract, lower fibers depress the shoulder and glenohumeral joint. Attachments are the superior nuchal line, ligamentum nuchae, and thoracic spine to the scapula and clavicle. Subscapularis, internal rotation of the arm at the shoulder. Again, subscapularis, internal rotation of the arm at the shoulder. Subscapularis, internal rotation of the arm at the shoulder. Connects from the subscapular fossa to the lesser tubercle of the humerus. Biceps brachii, flexion of the elbow. Biceps brachii, flexion of the elbow. Biceps brachii, flexion of the elbow. The long head attaches to the supraglenoid tubercle of the scapula, while the short head attaches to the coracoid process of the scapula. The distal attachment is to the radial tuberosity and bicipital aponeurosis. Brachioradialis, flexion of the elbow. Brachioradialis, flexion of the elbow. Brachioradialis, flexion of the elbow. The attachments are from the supracondylar ridge to the radial styloid process. Vastus intermedius. Oh, hold on. Vastus intermedius. Knee flexion. Vastus intermedius, knee flexion. Vastus intermedius, knee flexion. The vastus intermedius connects from the anterior and lateral surface of the femur to the quad tendon. Finally, semitendinosus, extension of the hip and flexion of the knee. Again, semitendinosus, extension of the hip, flexion of the knee. Once more, semitendinosus, extension of the hip, flexion of the knee. And the connection points are from the ischial tuberosity to the pes anserin.